Hi everyone, this is a detailed video of mine about actinic keratosis. Well, it's a rough, scaly patch on the skin that develops from years of sun exposure. It is often found on the face, lips, ears, forearms, scalp, neck, or back of the hands. Also known as solar keratosis, and actinic keratosis grows slowly and usually first appears in people over 40. You can reduce your risk of this skin condition by minimizing your sun exposure and protecting your skin from ultraviolet rays. Left untreated, the risk of actinic keratosis turning into a type of skin cancer called squamous cell carcinoma is about 5 to 10%. Earlier on this channel, I have already posted a short video about actinic keratosis. I hope you have seen that, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Actinic keratosis vary in appearance. Signs and symptoms include rough, dry, or scaly patch of skin, usually less than 1 inch, that is 2.5 centimeters in diameter, flat to slightly raised patch or bump on the top layer of the skin. In some cases, a hard wart-like surface, color variations including pink, red, or brown, itching, burning, bleeding, or crusting, new patches or bumps on sun-exposed areas of the head, neck, hands, and forearms. It can be difficult to distinguish between non-cancerous spots and cancerous ones, so it is best to have new skin changes evaluated by a doctor, especially if a scaly spot or patch persists, grows, or bleeds. Now I'll tell you the causes. An actinic keratosis is caused by frequent or intense exposure to ultraviolet rays from the sun or tanning beds. Coming to the risk factors, anyone can develop actinic keratosis, but you are at increased risk if you have red or blonde hair and blue or light colored eyes, have a history of a lot of sun exposure or sunburn, tend to freckle or burn when exposed to sunlight, are older than 40, live in a sunny place, work outdoors, have a weakened immune system. Now I'll tell you the complications. If treated early, actinic keratosis can be cleared up or removed. If left untreated, some of the spots might progress to squamous cell carcinoma, which is a type of cancer that usually is not life-threatening if detected and treated early. Now I'll tell you the preventive measures. Sun safety is necessary to help prevent development and recurrence of actinic keratosis patches and spots. Now I'll tell you some steps to protect your skin from the sun. First of all, limit your time in the sun, especially avoid time in the sun between 10 a.m. to 2 p.m. and avoid staying in the sun so long that you get a sunburn or a suntan. Use sunscreen before spending time outdoors. Even on cloudy days, apply a broad spectrum water resistant sunscreen with a sun protection factor, that is SPF, of at least 30, as the American Academy of Dermatology recommends. Use sunscreen on all exposed skin and use lip balm with sunscreen on your lips. Apply sunscreen at least 15 minutes before going outside and reapply it every 2 hours or more often if you are swimming or perspiring. Sunscreen is not recommended for babies under 6 months. Rather, keep them out of the sun if possible, or protect them with shade hats and clothing that covers the arms and legs. And the next step is cover up. For extra protection from the sun, wear tightly woven clothing that covers your arms and legs. Also, wear a broad brimmed hat, which provides more protection than does a baseball cap or golf visor. Avoid tanning beds. The ultraviolet exposure from a tanning bed can cause just as much skin damage as a tan acquired from the sun. Check your skin regularly and report changes to your doctor. Examine your skin regularly, looking for the development of new skin growth or changes in existing moles, freckles, bumps, and birthmarks. With the help of mirrors, check your face, neck, ears, and scalp. Examine the tops and underside of your arms and hands. Okay, now I will tell you the diagnosis. Well, your doctor will likely be able to determine whether you have an actinic keratosis simply by examining your skin. If there is any doubt, your doctor may do other tests such as skin biopsy. During a skin biopsy, your doctor takes a small sample of your skin for analysis in a lab. A biopsy can usually be done in doctor's office after a numbing injection. Even after treatment of actinic keratosis, your doctor might suggest that you have your skin checked at least once a year for signs of skin cancer. Now let me tell you the treatment. An actinic keratosis sometimes disappears on its own but might return after more sun exposure. It is hard to tell which actinic keratosis will develop into skin cancer, so they are usually removed as a precaution. Now I'll tell you the medication. If you have several actinic keratosis, your doctor might prescribe a medicated cream or gel to remove them, such as fluorouracil that comes with the name of Carac or Fluoroplex, Imiquimod that comes with the name of Aldara, and then there are some other medicines. Okay, and these products might cause redness, scaling, or burning sensation for a few weeks. Okay, now I'll tell you about surgical and other procedure. Many methods are used to remove actinic keratosis, including freezing, that is also known as cryotherapy. Actinic keratosis can be removed by freezing them with liquid nitrogen. Your doctor applies the substance to the affected skin, which causes blistering or peeling. As your skin heals, the damaged cells slough off, allowing new skin to appear. Cryotherapy is the most common treatment. It takes only a few minutes and can be done in your doctor's office. Side effects may include blisters, scarring, changes to the skin texture, infection, and changes in skin color of the affected area. The second procedure is scraping, that is also known as curettage. In this procedure, your doctor uses a device called a curette to scrape off damaged cells. Scraping may be followed by electrosurgery, in which the doctor uses a pencil-shaped instrument to cut and destroy the affected tissue with an electrical current. This procedure requires local anesthesia. Side effects may include infection, scarring, and changes in skin color of the affected area. Laser therapy. This technique is increasingly used to treat actinic keratosis. Your doctor uses an ablative laser device to destroy the patch, allowing new skin to appear. Side effects may include scarring and discoloration of the affected skin. Then the next option we have is photodynamic therapy. Your doctor might apply a light-sensitive chemical solution to the affected skin and then expose it to a special light that will destroy the actinic keratosis. Side effects may include redness, swelling, and a burning sensation during therapy. Okay, so this was my video about actinic keratosis. I hope you like this video. If you have any questions about this, please let me know in the comment section. Thanks for watching this video. See you in the next video. Bye for now.